It's a really great pleasure to be here. I'm kind of out of my normal place, but it's fantastic to have a session like this with a group of people like you who have so much influence in our society to make change. So thank you very much for asking me along. So I'm just going to talk about the role of government, the kind of things we need to be pushing government to do, talk a little bit about how industry influences, which I think reflects back on how we need to influence, a little bit about social marketing and education, and then finish with current opportunities. So I'm just going to talk a little bit about where the Obesity Policy Coalition came from, and it was really birthed out of tobacco control and the policy and advocacy work that was done through groups like ASH Australia, where I went when I finished university, and I spent many years working in tobacco control before I moved into obesity prevention when the OPC was created in 2006. And the groups that came together to form the Obesity Policy Coalition really understood that policy and regulation really needed to be part of the platform, and that advocacy around those elements was really important. And when the OPC was established, we decided to focus on the food area, mainly because the industry, the processed food industry, was very much focused on the physical activity area. So we felt that there perhaps wasn't so much of a need for us to be in that space. And my team are made up of lawyers. I'd love a doctor, but they're mostly lawyers, so we have a lot of arguments, and they keep me true to myself, but it's much better to have those discussions inside the tent than outside the tent, because you are going to be challenged once you get out of your comfort zone into the halls of power. So we look at, we analyse policy initiatives, we undertake research to develop the evidence base. I've just done a paper to look at the impact of a 20% tax on sugary drinks and what that would do to health outcomes and how much money it would save the hospital system. And I'm working with the dentists to look at something around the impact on dental health outcomes. We work with all levels of government, but we do a lot of work with state governments and the federal government, and we try and provide leadership to guide and assist researchers and policy professionals like the College of Physicians. So the role of government and regulation is, how important is it? And I think this slide really illustrates that public health benefits from legislation. It also helps to iron out inequalities, and it's really the basis of change, serious change that we've seen in our community in public health areas, including tobacco control, obviously, but vaccination, motor vehicle safety, that kind of thing. And I have a little interactive quiz for you, but I haven't put this on the app. I just want you to put up your hand. Take a look at this framework for action around tobacco control, and just put up your hand if you think this was written in the 60s. Any hands? Does anyone think in the 70s? Couple? 80s? More? Yep. 90s? Yep. Have to vote. 2000s or above? Okay. So this is really interesting because this has a background in the College of Physicians. This was written by the Royal College of Physicians in the UK in 1962. So let's reflect on, the problem often isn't what to do, it's really getting it done. And I think we need to know that this is a long game. This basically reflects tobacco control now in 2017, slightly different, but basically the basic tenets are there around restricting junk food, marketing of tobacco, that kind of thing. So the problem obviously is government, getting them to adopt these kinds of policies. And why is that a problem? When we have a blueprint for change, what are the issues? And I think Margaret Chan touched on this in 2013, where she talked about the interests that you come up against with these powerful economic operators. And she, like me, I'm with her on this one, see it as one of the biggest challenges facing health promotion and public health. We've got big food, big soda, big alcohol, and they all fear regulation and protect themselves by using the same tactics. They're front groups, lobbies, promises of self-regulation, lawsuits, and industry-funded research that confuses the evidence and keeps the public in doubt. They rely on corporate social responsibility in the eyes of the public, and they place the personal responsibility for health on the individual and portray government actions as interference in personal liberties and free choice. So this is formidable opposition. We're up against it with big food, and we really need to learn from our experience with the tobacco industry how to manage this. It's not a failure of individual willpower, it's a failure of political will to take on big business. So what are the key policy issues that we're dealing with? We've got the prevalence and cost of chronic disease. We've just had the Victorian budget, millions and millions and millions going into the hospital system, millions going into emergency care. I'm not saying that shouldn't happen, but really just putting the ambulance and a bigger ambulance at the bottom of the cliff without putting a decent fence at the top, it's the triumph of hope over experience to think that anything is going to change. So we really need to focus on prevention as well as acute care. We need to develop and advocate the case for prevention. We need to create a sense of urgency. I mean, this is a real problem. You're all dealing with it every day. We need to develop the research and evidence base and build consensus about what we need to do. We've had a bit about the problem. I'm not going to talk about it now, but the burden of disease is great, and this is only going to get worse. And we know that the burden of disease from tobacco is going to continue to reduce. So what should be done, and I'd like to thank Louise for this slide. We really have, people are pushing against their environment, and Nick Cormus talks about his patients having a white knuckle ride trying to lose weight because the environment, how can you find an apple in a vending machine at a hospital? They don't exist, and when I go into hospitals and look at the food supply, I just think, this is just outrageous. It has to change. But we have an environment that is unsupportive of healthy choices. That unhealthy choice is the easy choice. So we have a steep environmental gradient. Unless we change that, it's going to be very hard for people to change. So what, I don't know if this is oh, God, I've gone backwards. So how can governments support healthy food preferences? And this is from The Lancet. I'm really glad they've gone into infographics, but this is a series that's fantastic. I recommend it to you. And you can see the role of government policies up there in the top corner. And the kinds of things that government can do and should be doing is restricting junk food marketing to children, ensuring that we have interpretive front of pack labelling. We have the Health Star system. It's not across all foods because it's not legislated. We need to tax unhealthy foods. We've had a lot of success in Mexico taxing sugary drinks. It's really moved people to water. Same in America. We need to look at education around healthy eating, subsidies of healthy foods. Food standards in schools are really critical, and I would say workplaces and other institutions as well, because we know that that protects people against unhealthy eating and helps them eat better. Incentivise retailers to enter low income areas. That's very, very important that remote communities have access to healthy food. Regulate where placement of fast food outlets can occur. So there's a lot that government can do. They have a huge role to play here. And I think we need to understand again that the environment shapes what we do. So why is progress so slow? So the food industry is very influential, very powerful, and I've been told by various people they are in Parliament all the time, everywhere. We don't have enough pressure from a range of organisations to get change like we've seen in South America. Government often isn't able or is unwilling to act huge political capital to do things like Nicola Roxon did with plain packaging of cigarettes, and we don't have enough evidence, and the bar is set very, very high. A lot of these things you can't do a randomised controlled trial to show that they work. And this is just an example of where industry has concerns. This is a slide from Coca-Cola Europe looking at what sort of impact public policies may have on how they work. And I'll just point out to you the top further corner talks about what has the highest business impact and most likelihood to materialise, and that's taxes. And that's really sugary drink taxes that they're worried about. And if you move across along that top business impact area, you can see advertising restrictions on sugary drinks, for example, or advertising restrictions on high-fat, salt, sugar foods. Down the very bottom, you can see banning advertising to children under 12 is not considered to have a business impact. So this is very telling from industry. And how industry organised? They organised very quickly. This is when the Grattan Institute went up to Canberra to promote a tax on sugary drinks. They worked together in an alliance. This was out by an hour after that statement was made, and they outlined their contribution to the economy, $311 billion businesses in that group, that they employ 15% of the workforce in Australia, and it didn't include the companies that actually make sugary drinks. So Pepsi's not there, Schweppes isn't there, Coca-Cola. These are the sugar refiners, the Australian Industry Group, the Sugar Milling Council, the Australian Association of National Advertisers, the Australian Association of Convenience Stores. And they use classic tactics to defer and change the focus. So they say, we recognise we have a role to play. We'll promote healthy, balanced lifestyles. We'll develop nutrition information and labelling at point of purchase. We'll increase the availability of products with fewer kilojoules. We'll ensure certain products aren't marketed to children. Well, that doesn't mean Cocoa Pops, let me tell you. And support physical activity and nutrition programs, contribute to research and evidence, and develop partnerships to advance science, and defend the interests of our sugarcane farmers, welcoming a conversation. So they frame the issue as a problem for the individual. This is the Barnaby Joyce diet, eat less food. And Barnaby says in this that the Australian Tax Office, around a tax on sugary drinks, is not going to, he says the Australian Tax Office is not going to save your health. Do not go to the ATO as opposed to going to your doctor or putting on a pair of sand shoes and walking around the block. So that's the political situation. That's tricky, but social marketing and education can start a conversation and can soften the ground for policy, and also help people like you with your patients raising the issue of overweight and obesity. We've seen in New South Wales a campaign called Make Healthy Normal. In Victoria, we have a campaign called Live Lighter, which also runs in Western Australia, ACT and Northern Territory. Plus they have other supports to help health professionals. Live Lighter does training, and I'm just going to show you an ad from Live Lighter around sugary drinks.
Sports drink, fruit drink, energy drink or soft drink. The sugar in any sugary drink is sugar your body doesn't need, so it gets turned into fat, including toxic fat, which can lead to cancer, type 2 diabetes and heart disease. Breaking a sugary drinks habit won't just reduce fat around your waist, it will reduce toxic fat around your vital organs.
So the question is, did that make a difference? And we've done a study with South Australia as our control group, and in Victoria looking at the impact of that advertisement. And there was a significant reduction in people who saw that advertisement, particularly in people who drank 4 cups or more of sugary drinks per week. So you can see, not very clearly, but it went from 31% to 22% after people saw that advertisement. It's a very simple message. It's something that GPs and health professionals across the board should be raising with their patients. But it also provides a platform for advocacy, and in Western Australia, they're trying to get junk food out of children's sports sponsorship. They wanted to raise the issue of the sugary drinks sponsoring the Olympics. Coca-Cola's a sponsor, and so they did that campaign. What do the public think about government engaging in policy? High support, really high support, much higher than we saw in tobacco control at the same time. Page 3 of the Herald Sun, everyone knows the politicians read the Herald Sun. Mums want a fat tax, my favourite title ever, and we did that research. So this is a great way to get your research to change public the public. Now, I just want to finish on talking about this consensus prevention manifesto that I've developed with a steering committee and that we provided to the College of Medical Presidents, and it's, some of those elements that are in it are adopted. We're calling for groups. We've got more than 20 national organisations supporting this so far. We're looking for further support to really provide a platform to government around what needs to be done. I'm not going to go into the process of developing this, but it's very, very important that we have a united front around what we'd like to see government do as a starting point in obesity prevention. I think treatment's another issue. And finally, what would I like to see? This is the kind of headline I'd like to see. I think this is in the UK, this is top doctors calling on government to change. It's really important that you are part of this conversation. We've seen fantastic leadership by Nick Talley. We've really supported him, providing him with briefing materials when he's gone in and talked about taxing sugary drinks. And you all have a role to play. You have a role to play within your communities. I would really love to see hospitals getting rid of vending machines and doing things like the Alfred Pudding, taking sugary drinks off sale altogether. We've seen that happen in the YMCAs. We're seeing a shift in the community, and I think we all have spheres of influence, whether it's our sports clubs, our gym. My husband and I got rid of the junk food in our local gym, and those kinds of things have to be challenged. I'm about to go and lecture Deakin medical students, and on my way in, I'm going to switch off all the junk food and junk drink vending machines, just as my protest. I did say they should be doing that. They might have done it. I don't know. I'd asked them to do it last year. But anyway, I think we all need to rebel. We all need to be disruptive. We all need to make change. And I'd really encourage you to be agents for change. Thank you.